I was very lucky and honoured to be invited onto a radio show on BBC Essex, and it was to give my opinion and my thoughts on the waiting lists that women are having to endure for gynae procedures in the UK, and also about the length of time, the disgraceful length of time it takes for women to be diagnosed with endometriosis. There was a lady on who runs an endometriosis charity, and she also said, and I completely and utterly agree with her, that if men were suffering from this problem, they wouldn't have to wait 7 years for a diagnosis. They wouldn't suffer in pain for 7 years before getting a diagnosis. And unfortunately, this is the state of what women are having to put up with. And unfortunately, it's a failure in the medical profession. I love the NHS. I think they're amazing. I would never want them gone. But there are serious failings, and that needs to be addressed immediately by the new government. And I'm sure anybody who does what I do as a fertility specialist acupuncturist, as a somebody who specialises in women's health and gynaecology, this is not good enough. And I would like to put it out there. I'm calling on the new government to pull their fingers out of their backsides and sort this out. Women are being failed on a daily basis. They're in appalling agony and are just told to get on with it. They're told to take more medication. That it's affecting their lives, it's affecting their mental health, it's affecting their physical health, it's affecting their relationships with their partners, with their children. When's it going to stop? So it's just let's stop messing with women's health and their lives. Anyway, rant over. Endometriosis is a massively important subject, and unfortunately it affects many women. Very young girls can have it and then are just told they've got painful periods. Let's stop doing that. Let's actually take women seriously, irrelevant of their age, and do proper investigations. Let's do MRIs. Let's do, if necessary, if you need to, laparoscopies. I could never say it, apologies. But let's start getting these diagnoses, and let's start treating these women with the respect that they deserve, and give them the care that they deserve. I'm very fortunate that I do see a lot of women that I'm able to help and able to control their pain and able to give them some respite and some hope. With the fertility patients that I see, many of them also, their fertility is compromised by misdiagnosis, by being told that they've only got a little bit of endometriosis. Well, also that, in my opinion, is not good enough. You know, if you've got a little bit of endometriosis, you have endometriosis and it will affect your fertility, full stop. So if you do want to have a discussion with me a little bit further about endo, I've also reach out, DM me, comment on this live. I'm more than happy to talk to you. I've also, if you scroll back in my posts, I have a much longer conversation about endo and what it is, and also on my YouTube channel. Please feel free to come and search me out on my YouTube channel, Path to Wellbeing. But yeah, let's stop messing around with women's health. And the government has not this government that's been in for 10 days, the previous governments and the government before that. Let's sort this out. Let's put an end to the suffering that women are going through. Take care.